Hello, listeners. Thanks for tuning into The Spark, Medical Education for Curious Minds, where we present the people and stories behind medical advances at UCSF, including those led by medical students, physicians, and faculty in the School of Medicine. Through The Spark, we share the innovations at UCSF that are helping bring more equitable and better care to our communities. I'm Karen Fleming, Communications Manager for the Office of Medical Education.
And I'm Greg Gadwood, Instructional Designer for the Technology Enhanced Education team.
This episode kicks off the second season of our podcast, and we're looking forward to bringing you new episodes over the coming year. In this episode, we'll hear from Dr. Scott Steiger, Associate Clinical Professor of Medicine and Psychiatry and Deputy Medical Director of the Opiate Treatment Outpatient Program at Zuckerberg San Francisco General Hospital. Dr. Steiger will discuss his research and patient care initiatives in treating people with substance use disorders in some of the city's most vulnerable communities. We also talked to first-year medical student Aishwarya Thakur, who shadowed Dr. Steiger at the General and who will be pursuing a summer research experience in addiction medicine for adolescents. So, Dr. Steiger, could you tell me what sparked your interest in substance use disorders and or addiction research?
I trained in internal medicine and primary care setting, and a large part of what we deal with in that setting is behavior change. And what I was most interested in during my first couple years of residency was that people with substance use disorders, it seemed most obvious that the behaviors, they were the disease, as it were. And I got interested in the treatment of those individuals because I found out that it could work. That there are many effective treatments for opioid use disorder, alcohol use disorder, and they don't involve just sending people away to peer support groups like Alcoholics Anonymous, which, to be fair, are completely helpful for many individuals. But what I was most interested in was bringing treatment into medicine.
So you mentioned opioids and alcohol. When we talk about substance use disorders, what else are we dealing with here?
Yeah, so substance use disorders or addiction is a disease of the brain, and it is a chronic disease. So it's not something that I can just perform a surgery and fix it, or do a simple procedure and fix it, or send somebody away for 28 days and fix it. It's a disease manifest by maladaptive behaviors that hurt a person, whether it's hurt their health, hurt their interpersonal relationships with others. When we talk about substance use disorders, it's always related to pursuit of a substance. And they use the substance either in order to feel better or quote unquote get high, or more commonly, by the time they're ready to come into treatment, it's to avoid feeling bad or avoid withdrawal. There's a developing neurobiologic explanation for why those two things are the neurologic basis for why people manifest these behaviors. And there are increasingly targets that we can hit with pharmacotherapy or other interventions to try to help prevent progression of the disease or prevent worsening of the behaviors and in fact resolve the behaviors so that people can live the kinds of lives that they would like to live.
So when helping plan courses or electives for students in the British curriculum around substance use disorders, what were some of the key themes or issues that you felt important to incorporate?
We wanted to give the first year medical students a lot of context that is not reliant upon medicalizing the condition. And so first exposure that is provided is a lecture from an anthropologist. Kelly Knight gives an introduction into structural competency and how systems interact with people who use drugs outside of the medical system. And then that's immediately followed by a panel of people who use drugs or who are actually in recovery from substance use disorders. And I facilitate that panel and have brought in colleagues and patients of mine to present to students. And so the themes were, we wanted to really expose students to people who use drugs or who are in recovery from substance use disorders outside of the immediate medical encounter. Because by the time they reach the clinical setting, they are meeting people or thinking that they're meeting people who use drugs exclusively in the context of when those behaviors that I mentioned have led to negative consequences for that individual. They are meeting with someone who has really bad chronic pain, and the patient is, or even acute pain, and is needing management with an opioid, and the person, it also happens to have a substance use disorder. And so we wanted to provide people with some context of seeing people who are doing quite well in treatment early. And we wanted to provide them with a bigger context, a social context for people with addiction before we get to that sort of time in the clinic.
Let's hear from first-year medical student Aishwarya about how the medical school curriculum is helping learners prepare to treat people with substance use disorders and customize care for those in underserved communities.
For a lot of us interested in medicine, we're interested in the science behind it and also the people. And for me, that manifested in this interest with how substance abuse interact with people and how it makes them feel and why they're using it and why they continue to use it and how that affects their interactions with other people. And I'm very interested in this intersection between mental and physical health. I think addiction is one of those things that's very much both. It affects how you think, and it also affects your interactions with other people. But it also is affected by external factors like your housing and your financial status and the people around you. And I think that's what's really interesting to me about it, how it can be as much of a mental health issue as well as a physical health issue.
What were some of the key themes or issues that arose in the Bridges curriculum course you took on substance use and addiction in the health and individual block? And what was the most surprising thing that you learned?
I think the health and individual block was a great way for us to learn about these various different issues that arise, that will arise in our medical education and in the medical setting in the future. One of the really cool things that we had the opportunity to do was go to an AA and NA meeting of our choosing. And that was really amazing to be able to sit in on one of these meetings and see how people who were recovering from various addictions dealt with that and how they had a support environment to do that through. And I think we learned a lot just being observers and stepping away from kind of our white coats and kind of the medical treatment of addiction and just see in the community what it's like for people who are recovering from addiction to have that support.
Dr. Steiger.
We are currently planning the very first foundational science in Foundations 2 day for addiction. The very first one will take place in October. And as part of that, we're trying to sort of pull along that initial notion of bringing in actual people who are in recovery, while at the same time developing further the students' sense and competence with diagnosing substance use disorders, which have a defined set of criteria. And we are trying to also introduce both the concept of treatment, like how we can treat this in a medical setting, and moving patients' behaviors and thoughts about treatment, how students can communicate with people who may not be ready for treatment about what their treatment options are, number one, and number two, how they can be safer in their behaviors even when they are not ready for treatment yet. If you had diabetes and you didn't want to take the medication that I prescribed for you, I could still talk to you about how you could stay safe and avoid complications from diabetes. Like you could lose some weight, you could exercise, you can come in if you see these warning signs. And students kind of pick that up very quickly and understand that. They don't necessarily get that message from other clinicians with regards to addiction, that reducing harm from the behaviors that accompany addiction is a valid point of counseling for patients who are using drugs currently.
So, treating patients at the Opiate Treatment Outpatient Program here at the Zuckerberg, what do you see as being some of the toughest challenge in treating or managing these people?
We are a methadone clinic right now. We're an opiate treatment program. So what does that mean? That means that it's a very effective and very regulated treatment modality. We are able to take people who come in to us who are living on the street as a result of their substance use disorder and who have multiple complications, medical and otherwise, from their substance use disorder and help relieve some of that suffering and, in fact, extinguish the behavior of injecting heroin. The biggest challenge that we face is getting people housed when they're in this vulnerable period, even when they are able to start to address the addiction and get people services that they need. It's harder than it ought to be, is what it boils down to. And I wish that from a social perspective, we took better care of our people. Just if we looked at this in that light, like if taking care of our fellow humans was part of the job of society, then I think we would do a better job of that. But not having adequate basic needs makes it really hard for our counselors, our nurses, our nurse practitioners, our doctors to really do the job of keeping people safe and keeping people, helping people that want to stop using drugs from using drugs. And I can certainly provide people with medication. We can provide them with food that we get donated. We can provide them with clothing that we get donated from other people. But it's hard in a place like San Francisco to get somebody housing just by writing it on a prescription pad.
When it comes to solutions that we can have an impact on, what are you most inspired by, or what most excites you about progress that has been made in helping these people?
I am most inspired by the work of people who get out there and really, really do the work with the people, and often are people who use drugs themselves or people who used to use drugs. There's amazing groups like the DOPE Project, which is part of the Harm Reduction Coalition across the United States, real leaders in the field here in San Francisco. Eliza Wheeler heads that up, and she really has done an amazing job of making sure that naloxone, which is the antidote to opioid overdose, is widely available amongst people who inject drugs in this community. And it's probably a good part of why in San Francisco we have not seen the spike in opioid overdose deaths that we have seen in the rest of the country. I am also proud of the way that some of my colleagues have worked with those groups to try to get the word out to some hard-to-reach populations about safety issues. When we find out that there is a contamination in the drug supply at the San Francisco Department of Public Health, helps to publicize that information to people who use drugs. I am excited by the work, most excited right now by the work of the Department of Public Health and the task force that released its report last fall recommending the establishment of supervised consumption services for people who use drugs. And what does that mean? Well, that means if you are homeless and don't have a safe place to use drugs, but you are currently addicted, you can bring your drug into a facility and under the watchful eye of people who are there to help you. You consume the drug, and if you were to overdose, there's somebody there to save you. If you are ready for treatment at that moment, there's somebody there who can help you get that treatment.
Let's hear from first-year medical student Aishwarya.
I understand that this summer you'll be in Boston at the Children's Hospital working in the Adolescent Substance Abuse Program. What do you hope to learn there?
So I'm really interested in adolescent medicine and how adolescence is kind of the age where a lot of different things are happening in terms of physical health issues as well as mental health issues. And I think substance use is one of those things that we can really work with adolescents with and help them at an early age. And a lot of the work that I'll be doing is with adolescents who have chronic health issues. And they've been dealing with that for the majority of their life. And that, makes them more vulnerable to various substance use issues. And again, it's really interested in how, one, physical health issues affect your vulnerability to addiction and substance use. And hopefully we'll be able to do more research.
Let's take a step back for a minute and put this in context. In a city like San Francisco, just how deeply embedded are these issues and what are the implications of addiction and substance use?
The San Francisco Department of Public Health reports that over 22,000 people inject potentially lethal drugs in San Francisco, and upwards of 120 people die of opioid-related complications annually. Almost 70% of injection drug users report living on the streets or using homeless shelters. Substance use disorders change the affected person's lifestyle, priorities, and behaviors, and interfere with their ability to work or go to school and have good relationships with friends and family. In the past decade, the Bay Area has seen a breathtaking surge in opioid-related fatalities, non-fatal emergency room admissions, and non-fatal hospitalizations. Through 2014, a 48% increase.
I'm struck by the depth and complexity of substance use disorders in the context of housing-related challenges and homelessness in the city. What's inspiring Dr. Steiger to keep pushing forward with work despite all these challenges?
It's been inspiring to learn about the work of faculty such as Dr. Steiger in treating substance use disorders, as well as the medical students advancing their careers in this area. Stay tuned for more inspiring stories in our next episode, where we'll talk about other UCSF School of Medicine initiatives aimed at caring for the city's underserved, under-resourced communities.
We hope you've subscribed to The Spark on SoundCloud, iTunes, or YouTube. The music in this podcast comes from Poddington Bears Egress, licensed under CC BY NC 3.0 and available at the Internet Archive.